Today we are discussing about fibroids.
Yes. It's a fibrous tissue of the uterus of a woman.
So what is the largest size?
They range from different sizes to as smallest like a seed, even to as big as a pawpaw or a watermelon. It can coexist with the pregnancy. But if it's growing larger as the pregnancy goes, it tends to cause abortions.
Hello viewer, welcome to today's episode of Health Talk Show. This is where we educate, we promote, and we update about health. Today in studio, we are going to discuss about Spina Bifida and Hydrocephalus. My name is Lucy Wanza Kariuki, and I am your host for the show. In studio with us, a special guest all the way from Kijabe Hospital, and I would like to invite them so that they can introduce themselves and they will be taking us through the show. Welcome our guests. Kindly introduce yourself. I start from my near hand.
My name is Asifa Monaisha. I am a youth leader living with Hydrocephalus and Spina Bifida.
Thank you.
My name is Jane Mutida. I'm a healthcare worker based in Kijabe in a program called Bethany Kids. Thank you.
Thank you.
My name is Cecilia Wanjiro Nderito, a mother of a child with the defect Hydrocephalus and Spina Bifida.
Wow, thank you very much. Today we are going to discuss about Hydrocephalus and Spina Bifida. And with us in studio is our clinician who is going to help us to unfold what these words mean and how people cope with them.
Hydrocephalus is a disability or a condition that can occur to any one of us regardless of the age. The word hydro means water, cephalus means the brain. And so hydrocephalus is the accumulation of cerebrospinal fluid in the brain. Cerebrospinal fluid is a fluid that is produced in the brain, and every one of us is making the fluid right now wherever you are. But then the difference comes when it comes to the flow of that fluid.
Yes.
In a child with hydrocephalus or an adult with hydrocephalus, you find that the flow of that fluid is blocked somewhere by a certain blockage. And so when we come to hydrocephalus, what happens is that the surgeon or the doctor has to make a diagnosis and then decide on what is the cause of that hydrocephalus and do his management accordingly. When we come to hydrocephalus, there are two types. They are categorized in two types. We have one which is congenital. Congenital means that the child is born with hydrocephalus.
Yes.
And mostly the cause is unknown, and it can also be associated with a genetical factor. The other category is the acquired hydrocephalus. The acquired hydrocephalus is whereby there is an underlying condition that has brought about the hydrocephalus. Such causes or such things that can cause the hydrocephalus that is acquired are like a tumor. If you have a tumor in the brain, it means that the spinal fluid that has been produced in your brain will not flow easily. There will be a blockage by that tumor. The other cause is prematurity.
Yes.
When a child is being born premature, the skull bone are very fragile. And during the delivery, at times the pelvic bones of the mother can compress the brain of this premature baby and premature bones. And so they can cause a bleed into the brain. And that bleed can go and clot. And when it clot, it means that it can block that channel of the flow of the fluid. The other thing that is acquired and it can bring about the hydrocephalus is a condition like meningitis.
Yes.
Meningitis is the inflammation of a certain part of the brain called the meninges. And when that infection, because I know most of us, we know meningitis, as especially for our children.
Yes, we have
when they have that meningitis,
yes,
that inflammation can cause a scar in the brain. And that scar tissue can make can result into a blockage within the flow of the fluid.
Yes.
And that is why we mostly advise our parents or them that are in their age, age-bearing stage. We advise them that when a child gets sick, do not just go to any clinic.
Yes.
It is good to go to a pediatrician or a hospital that has a reputation such that your child can be treated well. Untreated meningitis is really fatal. It can cause your child to develop the hydrocephalus. And some of these things you may find a child being treated partially. And so when it is partially treated, the meningitis can resort to the hydrocephalus. There are other things that are thought to be risk factors also of the hydrocephalus, especially when it comes to adult.
Before we go to the other factors, before we even continue, very good points there that there will be accumulation of fluid, water, if you call it, in the brain. And you've outlined two causes, mainly causes. One is blockage of those channels which transport that fluid, and overproduction of the fluid. It can just be overproduced. And I am sure that we have seen people with hydrocephalus, but now they couldn't be able to tell whether or the name of the condition. But before you tell us the signs and symptoms of this condition, I would like to welcome one of the parents who has had a child. At what stage did you realize what was wrong with your child?
Okay, thank you very much. At first, when I gave birth to my son, because now he's 9 years,
Yes.
I didn't notice he
9
had.
years.
Yes, now he's 9 years. I didn't notice he had hydrocephalus at first, but because he suffered from another condition that is Spina Bifida, which comes one in one with the
Yes.
hydrocephalus. Then after a few days after we were given the counseling at the hospital, we were told after some days you may notice some changes in the size of the head, the head size of the child.
Yes.
So when we went home, I started realizing that my son's head was growing big. The centimeters were increasing day in, day out, and he couldn't close his eyes correctly. He was half sleeping, you see. So we went back to the hospital, and that's when we did some tests, and he was diagnosed with hydrocephalus.
Wow, thank you so much. Our clinician, what is the normal size of the head circumference of a child at birth? Because one thing she has mentioned is that it was increasing. So at what baseline measurement should we base?
The normal head circumference is between 34 to 35 centimeters.
34 to 35 centimeters,
yeah.
Which means...
Yeah, anything above that, it triggers you to first now start thinking about it.
Okay. Can you take us through the signs and symptoms so that we could be able now to understand what the parent was able to see?
Well, when we come to the signs and symptoms that a parent can observe and see and then take an action.
Yes.
I want us to first go to what happens with the fluid that is in the brain. When that accumulation is too much, it will cause pressure. And this pressure is the one that now gives rise to the signs and symptoms. In the brain, we have vital organs that help us in many things. The brain is very delicate and very fragile, but there are some organs that are there. For example, we have the ability to see. We have the optic nerve, the nerve that helps you to see. And so when a child has a hydrocephalus and that pressure is so much, it can press on that nerve. And what will manifest is that the child will have sun-setting eyes. Like you can see whatever is screened there. That child has a very big head, and the eyeball has, has gone down. It is like a sun that is setting. And so when a mother sees a sun setting eyes, she has, or he or she has to think that maybe my child has hydrocephalus. The other sign that will come is when the fluid is so much in the brain, that very child with the sun-setting eyes will have a very full fontanelle. A fontanelle is just a soft spot around this region. And so when the fluid is so much, it looks for places to occupy. And so the head will now enlarge, and the soft spot of a child will also grow big, and it can even be full, it can bulge, and at times, we see children having their pulse, pulsation on the soft spot.
Yes.
And so with this child who have a very tense soft spot, will not have a pulsation on that region. The other...
Can it burst?
It cannot burst.
Okay.
Even if it swells and there is a lot of pressure, it cannot burst because the skin again is the skin is very tight. It cannot really burst. The other sign that you can note on a child is the child may start vomiting. And the type of vomiting that the child will manifest is the projectile, type. The child will just vomit, and the vomiters will just go, to a very distance. And at times you may sit with the child like this when you're holding the child and nothing has triggered the vomiting, but you just find the child vomiting, not that you're feeding the child. So they vomit at times that you would not even think that this child can vomit. The other sign that they can note is the fever. The child becomes very hot in the body, and at times our parents are confusing the hotness of the body to the hotness of the head.
Yes.
These children are hot, when you touch the scalp, you find that they are hot because, again, of the activities that are happening within the brain. But the hotness that is really a manifestation of a hydrocephalus is the fever that is, systemic. It is the whole body.
The whole body.
Yeah. This child will be irritable. If the child is young or even a toddler or an infant, they will be irritable. And this is because that pressure is really giving them a headache. They just feel like they are irritated. They don't want anything. And these will also resort to refusal to feed or to breastfeed. They try to suck, but they do not have any strength, and their bodies are very weak.
Every time we talk about child health, we just imagine what is going in the child, and the mother or the father cannot be able to do much. They cannot be able to express themselves. But with us in studio today is one of the survivors. Kindly welcome and tell us, at what stage did you realize what is going on in your body? Welcome.
Thank you. I was born with hydrocephalus first of all, and Spina Bifida. But after surgery and all that, I did not know anything about hydrocephalus until 2017. Okay, I had the feeling, I knew something was in my body that it's not
Normal.
It's not part of me.
Yes.
It would react, like there's some chance that react to weather. When the weather becomes cold, it's called barometric migraine. So I used to feel, but I did not know until when I got into an organization.
Yes.
So that's when I started learning more about myself. And I used to conclude like, this is how I feel. Oh, so it's connected to hydrocephalus. But before then, I did not know because I went to a normal school. Nobody understood.
Yes.
Yeah, because people with hydrocephalus, they have slow learning. So the teachers could not understand why you're slow. You're slow in learning. The teachers could not understand why you have a headache when the weather changes. Yeah, so I began learning about hydrocephalus like really when I got into a group, a supportive group.
You were what age?
I was 20, yeah.
20.
19, 20, yeah.
Wow. Dear viewer, we are here in Health Talk Show, whereby we are educating you on Spina Bifida and Hydrocephalus. You can talk to us through our SMS line, which is 21144, or our Facebook page, which is GBS TV Africa, or YouTube channel GBS TV Africa. Stay tuned. We shall continue after the break.
Coronavirus disease is now spreading within counties in Kenya, from person to person through contact with droplets when an infected person speaks, coughs or sneezes, or through touching contaminated surfaces and objects. Anybody with a weakened body immunity has a greater risk of contracting coronavirus disease. People living with pre-existing medical conditions such as HIV, cancer, TB, diabetes, among others, must adhere to their treatment to strengthen immunity, and therefore should ensure they have a constant supply of necessary medicines. Contact your clinic or health facility for information on how to access treatment. Help others within your network to access adequate supply of essential medicines. Ensure that you remain connected with your local networks for any support, and follow the medical guidelines provided by your health facility to prevent coronavirus. Remember to stay updated with information on coronavirus using only trusted reliable channels. For more information on COVID-19, call 719 or dial *719#. COVID-19 is preventable. Protect yourself, your family, and the community. This message has been brought to you by the Government of Kenya and its partners.
Hello. Welcome to the GBS article, where entertainment meets enlightenment and creativity meets exposure. Join us on the most interactive art club in all of Africa. This is the Art Club with Ben C. See you.
Mziki right here on your number one TV station, GBS TV. My good name is Hypola the Experience. You can call me Moja Safi. Ukumanza, the best TV ever. Lafu shoni gani Mziki SMS line 21144.
Tunakuchezea zile ngoma mpya zenye zimekuwa zikitokea hii wiki.
Anytime ulizia bila God nikulia na wakinigeuzia, I know you got me God, yeah you got me God.
Kautamu Likisa maneno nasikia kautamu.
Ati wanauliza gospel imedu Bisa CMT we have to do. So Bible now we hand, so we physically, spiritually, lyrically, mentally.
Leo manze tuko na wasanii wa daily ndani ya nyumba. Tuko na muziki kali, tuko na countdown kali. Yaani kila kitu leo iko fresh. Chukua sharubati, hiyo ni juice hapo, mpaka juu ya meza.
Triple.
Yeah.
Tumia mtu salamu pale mahali unakulanga chapo dondo.
Nani mimi? Walifunga.
Coronavirus disease is now spreading within counties in Kenya, from person to person through contact with droplets when an infected person speaks, coughs or sneezes, or through touching contaminated surfaces and objects. Anybody with a weakened body immunity has a greater risk of contracting coronavirus disease. People living with pre-existing medical conditions such as HIV, cancer, TB, diabetes, among others, must adhere to their treatment to strengthen immunity, and therefore should ensure they have a constant supply of necessary medicines. Contact your clinic or health facility for information on how to access treatment. Help others within your network to access adequate supply of essential medicines. Ensure that you remain connected with your local networks for any support, and follow the medical guidelines provided by your health facility to prevent coronavirus. Remember to stay updated with information on coronavirus using only trusted reliable channels. For more information on COVID-19, call 719 or dial *719#. COVID-19 is preventable. Protect yourself, your family, and the community. This message has been brought to you by the Government of Kenya and its partners.
Welcome back, viewer. We are still discussing on child health, hydrocephalus and Spina Bifida, and we are going to continue with management of hydrocephalus. Kindly take us through the management of hydrocephalus.
Okay, thank you so much.
Yes.
When we come to the management of hydrocephalus, the management is through surgery. And there are two types of surgeries that are performed on anyone with hydrocephalus. The first surgery is to insert a shunt or a tube into the brain, and then that tube comes and drains into the peritoneal region. That is just a region between not the real stomach, because there are some people who have said that they have a pipe in the stomach, so they are not able to feed, they cannot feed their children because the fluid is filling the stomach. And so the tube is just between the skin and the stomach. And when the fluid is drained there, then the abdomen absorbs the fluid, and it takes important nutrients into the body, it hydrates the body, and so this keeps off the pressure that is in the brain. The other surgery that is done is to unblock any blockage that is in the brain. And mostly them that are unblocked are those that have a certain blockage within the brain where the spinal fluid is produced. And that procedure is called ETV. ETV means endoscopic third ventriculostomy. This means that you use a scope, you look at the blockage where it is, and then you unblock it. It is so easy. And then after that is done, with the goodness with the ETV is that the child doesn't have a foreign body, but with the shunting, the child or the adult will always have a shunt in place. And after that, you have to manage the shunt that is already in place.
Yes.
And this shunt can block, this shunt can malfunction, and so there are those signs that we teach the parent to look on, such that when they see such signs of blockage, they can come to us, and then we can do a revision of the shunt. Yeah.
So the management is surgery alone. Are there medication?
There are no medications to treat hydrocephalus. The only medication that can be given is just a supportive, medication, which is called Diamox. And that drug helps to drain a little bit of that cerebrospinal fluid, and then you urinate it as a normal process. But it drains so, very minimal amount that it doesn't have any great effect on the pressure that is in the brain.
We've seen several people with hydrocephalus walking around. Do they all have shunt?
Not every person walking with hydrocephalus have shunt. As I have said, there is this other procedure we said ETV, the one for unblocking the blockage.
Yes.
So not everyone has a shunt. And at the same time, you can also find somebody who was not done an unblocking plus a shunt. By God's ways, you find that somebody, the hydrocephalus was arrested. We call it arrested hydrocephalus. It was there, but in God's way, the blockage just disappeared like that.
Yes.
But the head will still be big because again, it was expanded by the a lot of fluid that had accumulated. So they will be walking as they have hydrocephalus, but we call it arrested hydrocephalus.
Okay.
Yeah.
To our survivor, you've lived with it for many years. Do you have a shunt, and how do you manage it?
Yes, I have a shunt. It was put in place at birth.
At birth.
Then it malfunctioned in 2010, and I had another one inserted. Yeah, due to not knowing how to take care of myself as a person with hydrocephalus,
Yes.
I lived normally. So I used to do things that I'm not supposed to do. And in that case, my shunt moved into my brain. So I had another one inserted right.
Okay.
Yeah, so with a shunt, you know when it has, there are signs that you feel when it's blocked, there are signs that you feel when it has an infection. So when you feel it has an infection, you consult your doctor, and there are medicines you're given. When it's blocked, there are certain procedures that you're done. Maybe you can have another one.
Okay, so now you understand, you have been taken through health education on how to take care of yourself.
Yes.
As a parent, are you aware of how to take care of it? And does your child has a shunt? How does the child survive, and how does it affect you as the parent?
Okay, thank you. My son has the shunt.
Yes.
He's 9 years now. So far, so good. Since he had the operation, we have not gone back to the hospital. We have not had any effects from the shunt. I can say it's working good on him. But sometimes it's challenging because you don't live like a normal parent, you know. There are those things you are like, what if my sons go playing outside with other kids? They don't know what is this. They just think it is a vein, because when he turns on, it is on his left. So when he turns, you can see it's a vein. So I'm like, when he goes out there, if he's playing with other kids, I'm so tense. I'm not comfortable. But when I learned that it has no effect, as in like he's praying and I teach him this is what you should do and this is what you should not do, I'm fine with that.
Does the child, living with such a child, affect your day-to-day activities?
Yeah.
How,
much.
for example?
Okay, at first he was very young when he had the operation, because his operation was done at 3 weeks after birth. So working,
3 weeks?
Yeah, 3 weeks after birth. So working, he needs some care. You should be there. As a parent, you are there. Okay, sometimes he happens to ask you a question, Mom, why do I have this thing on my head? Then if you don't have, you're not bold enough to answer that question, you'll be like, you'll hide some things. So I think between me and my son, we are very much open. I tell him everything. This is the reason why you have this thing. But before you carry that burden, it's very heavy.
Yes.
Yeah, before you carry it and put it on your shoulder, it's very heavy. It's just
Are you stigmatized, like you feel you're the odd one out every time you are around other parents in school, merry-go-rounds?
Okay, as for me, I would say stigmatization to me is a no.
Thank you.
Because I stand as me. We are all created differently, and having a defect that doesn't make you different from others. We are all created by the image of God. And God gave us these things because we are able to carry them. It's us who are able. And if I stand and someone else is looking at me, is like, oh, if I see Mama Johnny with Johnny, okay, I can do it. But nikijificha sana, they'll be like, oh no, I can't make it. So as for me, I stand strong.
Yes.
Not for I myself, but for even another person who is looking at me.
Yes.
Yeah.
So that one makes you stand above the disability.
Yes.
That one encourages other parents, and somebody watching you today will be able to understand that it is possible to live with hydrocephalus.
Very true.
Above it, there is life. Wow, thank you so much for that. And to our clinician, we are talking so much about Spina Bifida and this condition, which look very close. Kindly take us through the definition and the broad perspective of Spina Bifida.
Okay, thank you so much. Spina Bifida, I want to split the word into two so that we can understand it.
Yes.
Spine is the spine, and Bifida is a defect. And so Spina Bifida is a defect on the spine. Every child who is born has or everybody of us has a spine. And along that spine, when a child has Spina Bifida, there is that defect that you find along the spine, that the spine did not fuse well. And so when the child was being formed, you find that there is an opening along the spine, and within that opening, there will be bulging of some of the contents of the body, and that is how now a mass will appear when the child is being born. Yeah.
Wow, so there is a defect in the spinal cord. Many people do not understand how contents of spinal cord could be outside the body and that person survives. What are the signs and symptoms of spina bifida?
The sign that you'll definitely see is when the child is born, you find that mass on the back, anywhere along the spine. So any mass at birth along the spine, you will know that it is spina bifida, although it can be other things that are associated with it. But a spina bifida is not something that develops after birth. Spina bifida develops the first month of pregnancy. And by that time, even the mother doesn't know whether she is pregnant, yet the spine is being formed within those 26 days of pregnancy. And so that is when the spine will not fuse well, it will leave a gap. And what causes the spina bifida? Some of the causes that are related to the spina bifida, cause of the spina bifida, lack of enough folic acid in the body of the mother during the time of conception. Yeah.
So we understand that folic acid is a very important component, because that time when you have just described about the onset of spina bifida, it is when the cells of the body are organizing themselves. So what can you tell us about folic acid at that stage?
With folic acid, I know as mothers, when we go for our maternal care, we are given that folic acid in form of IVs.
Yes.
But then that folic acid does not help us in terms of the formation of the spine of the baby. And the advice that we would want to air is that the folic acid must be taken before conception, because the spine will form, the cells of the spine will start now organizing themselves within that 1 month. And normally we advise them to take the folic acid 3 months before conception.
Yes.
And the reason is your body may be in need of folic acid to do other things within the body. And so if you say that today I'm going to conceive and you start folic acid today, your body will use the folic acid for other aspects. And so we tell them, we advise them, take it 3 months before conception. But for a mother who has had a child with spina bifida, the advice is to have a folic acid intake every day throughout her life until the menopause. And this is because when you are once stricken, in case of anything, you get another child, it is very hard to rear that child.
Yes.
And bear in mind, this folic acid have its nutritional value also. It can build up your blood volume. So it is not just for the spine alone, it has that nutritional factor. Yeah.
Okay, I understand that folic acid is a metal, and taking it for a long time has also its own effects. For this person who is taking folic acid throughout their life, what is the dosage? Because they will not take like somebody on treatment. We understand there is that dosage which you cannot go beyond, because our bodies cannot be able to take heavy metals for long. And if we need this folic acid, is it available? In our shops, it is available in our hospitals, that is the government hospitals where common mwananchi is, and at how much if we are to buy over the counter?
Well, the folic acid for the mother who takes daily is 0.4 milligrams every day. We have it come in 5 milligrams a tablet, and it is available in all hospitals, it is available in all chemists. Even over the counter, you can get the folic acid, because its category, it's not really in the antibiotics that you have to need a prescription and an evaluation of your body. So you can buy it from chemists. And it is very, very cheap, very affordable, to any client. But in Bethany Kids, we do give them for free to those clients that we do follow up. We provide them freely.
There are people who cannot be able, as much as we say it is cheap, I'm sure there are still people cannot be able to afford. You will be telling us more about the supplements, other things that can supplement this folic acid. But before that, I would like to talk to our great parent here. If I may ask, are you aware that that Spina Bifida existed in your baby? Did somebody take you through the education about Spina Bifida? And how do you manage as a parent?
Thank you. At first, I didn't know anything about Spina Bifida. I didn't hear anything, even a hint. I heard it when I gave birth to my son. And the people who were taking care of me, they took my son, and I was lying on the bed. I was like, what happened to my son? Bring him back here. I can see there is a wound on his back. So they brought back my son, and I was like, what is this? It seems you hurt my son. They were like, no, it is a defect known as Spina Bifida. And I got mad at first because I have never had something like that, Spina Bifida. And I thought it is their recklessness. They have hurt my son at the back. And I was like, no, you must have done something to my son. And that's when they taught me about Spina Bifida and the causes. And what shocked me is that about folic acid, as our Sister Jane has said about folic acid. I took folic acid. But when did I take this folic acid? It was not before. I took folic acid 3 months after. 3 months when I was pregnant. So they didn't help the child in any way. I didn't have any complaints during my pregnancies, and I gave birth normal. So I didn't find any hint that I was carrying a child with Spina Bifida.
Yes.
Yeah.
Wow, I understand that many parents in the hospitals get terminologies that really shock them, especially during the diagnostic stage. But this is all about folic acid. It is something we cannot be able to avoid. It must be taken. Your body must have it because it helps in the formation of the DNA. That is whereby these things we call tuboneural defects or conditions that affect the spinal cord and the formation of the tubes in the body occur. And if it is missing, the DNA cannot be able to form normal cells. So I would like to welcome our youth leader from Kijabe. I'm sure you are a leader living with disability. How is it? How do you cope? What do you tell them?
Living with disability. Okay, living with disability is hard. It's not easy. But there are people who will always make you feel little. But living with disability, you have to be strong.
Yes.
Because living with disability, this is a journey. This is a bittersweet journey. Bitter because of the pain. Because anytime I may be here talking and the next thing, I'm all in pain. And it's sweet because you get support and love from people who are with you and outside. So anyone living with disability, any youth, you have to be strong. Why? Because these little ones, they look over to you, not the parents, because the parents never know what you're feeling. So if you don't stand strong, these little ones won't stand strong.
Yes.
Yeah.
Do you have like friends?
Yes.
And do they understand what you're going through?
Yes, because many of my friends have known about hydrocephalus. Many of my friends who are with me have researched more about hydrocephalus. Many of my events that I do in Shark, they are here with me. Yeah, so they get used to the disability life.
Apart from leading the youth, are you in any support group or psychosocial group that you are in, and how does it benefit you?
Yeah, I'm in a supportive group called Shaktika Youth. Shaktika Youth, all of us have hydrocephalus, Spina Bifida, or both like me. And we do like table banking. We do meetings to encourage each other, to learn more about, there are some little ones from age 13, they don't know themselves. they don't know how to handle themselves.
Yes.
Like when they get wounds, when your shunt blocks, it's not every time that your mother has to be with you. Yeah, you have to take care of yourself. So many of the times we have meetings to teach the people who know about hydrocephalus more, they teach the younger ones.
So you have speakers from outside who come to speak to you?
From
Are they healthcare workers?
Healthcare, like Nurse Jane here, they come over. Yeah.
Okay. What is the criteria of joining the group?
Most of we have a group also on social media. We have over the Facebook Shark Thika. Okay, Shark, we have 16 chapters from every place. It's not just Thika. So every place that you are, I believe that because Thika we are on Facebook, we are all over the social media, and I believe even the other Sharks group there all over the social media. But when you like, maybe when you text, you're given feedback on how to come to a meeting. Yeah, and even most of the parents, like me, I'm around Thika.
Yes.
So I'm in a group. If I hear someone has hydrocephalus, I will connect you to the group. Yeah, so we create awareness on different platforms.
No, you're telling me that if you understand somebody has hydrocephalus, you can help them, you can follow them up. What about the parents? Where they come in your group?
Okay, the parents.
Can they join, or it's the son?
No, they have their own group, the parents.
The parents.
Yes. The kids, we have our own youth group. And the parents have their own youth group.
Okay, for caregivers.
Their own parent group, yes. Because the parents have also their experiences, which they need to share. And the youth, we have our own experiences, of which maybe we don't know the experiences of the parents. So they have their own group, and we have our own.
Are there groups for both of you, both the parents and both the kids?
Yes, because sometimes we meet, both of us, when there are events. Sometimes the meeting needs all the parents and the youth. So we have to be there, all of us.
Okay, so for the parents, do you study or do you discuss matters concerning other family members who maybe can take care of your son or your daughter when you are not around? Or you own the child? The child is yours and yours, not for other people.
Thank you. I think the child is ours.
Yes.
The child is for everybody. For instance, right now I'm here and my son is back home with the sisters, with the neighbors. It's all about how we represent ourselves in the society.
Yes.
Because if I hide my son, the neighbors will never accept him. He himself will never accept himself. So when we expose the children to the community, they are able to live and to be very strong. Even if they used some devices like wheelchairs and crutches and so on, they can relate with others. The only difference is that they are more special.
They are not just normal children.
They are not just normal. And that special, I just take it in the positive way. Being special, I take it in the positive way because I see the love from the community to my son. They are like, "Hi, John, how are you? You are good." I like, and exposing somebody with disability at a time is an advantage.
Yes.
Though in some places you find people take it negatively, they'll be judging you and maybe to throw words onto you and your child, but who are you?
Now, as a parent, you have your own fears, but now we have your son. Does he face rejection, bullying, issues that maybe sometimes as a parent put you down?
Very true. There is bullying. And what is so much hard is that my son has both hydrocephalus and spina bifida.
Yes.
You find most of the kids with the spina bifida, they use the diapers. So when you take the child to school and you tell the teacher, I have a child, he's very bright, he does this and that, but he uses diapers, and they're like, no, in our school we can't accommodate such a person.
Mm-hmm.
What about the children they play with around the estate? They're like, oh, ona huyu mtoto mkubwa amevarishwa pampers, and he's like, ma'am, why are they telling me like this? So as for me, I understand the reason why, but yeye anakuwa akona ile shame. Mbona mimi mtu mkubwa na natumia diapers? So is very ako chini. You'll find people telling you, oh, this thing, it is a family thing, go to church, get some prayers, go to some prophets, get prayers, but if you start with the word of God, you just know that this thing is there.
Mm-hmm.
So when someone tells me, in our church, if you come to our church and then the pastor lays the hands on your son, he will rise and walk.
Mm-hmm.
And I'm like, oh my God, how many gods do we have?
Mm-hmm.
So it is very much the stigma outside there.
It's hard.
It's hard.
Oh,
It's hard.
we feel you. We feel it.
But if you stand for yourself, at a time you unajieka kando hivi unajitaka mkutano, you feel. But if you know inside you, it is not me who is fighting this battle. There is somebody inside me.
Yes.
Who is fighting with me. And there is another person who is looking at me. Like my son, if I go down, he goes down.
Yes.
So he's looking at me as the parent.
Does that one put you down such that you have fear of future childbearing? Now imagine not you, but speaking to somebody watching you. Can a disability make a mother, a father, to have fear of future childbearing and upbringing?
To me, I think it is a yes. It brought fear to me. Being that my son is 9 years, since then, he's the last born.
Yes.
It brought me fear. But why? I didn't know anything to do with folic acid, but now I know something. If I take those folic acid day in, day out, there are zero chances that if I get another child, he'll be free from Spina Bifida and Hydrocephalus.
Okay. That's very, very interesting to hear and very open of you. And I would like to invite our Earthwork Jen to be able to talk to us. Supplements of folic acid.
Okay, thank you. Apart from the folic acid tablet, we have foods that are rich in folic acid. And such foods are all green leafy vegetables, sweet potatoes, we have beans. But then the problem is, with all these vegetables having folic acid, there are things that have really depleted the folic acid that are in them. And number one is that we cook our food. If, like for the green leafy vegetables, you overcook them, the folic acid that is in it is depleted. Haitakusaidia. And so when you come to cook the vegetables and those are things like spinach, broccolis, you just need to steam them. After steaming, that way you will not kill the folic acid that is in it. And the other thing that have affected our folic acid in the foods that we eat are the way that we grow them. There are some fertilizers that we will use and they will deplete the folic acid in those food that are rich in folic acid. Our soil also has been destroyed by all those fertilizers that we do put in our shabas. And so by the time you grow your crops and think that you're taking folic acid, it will not be enough. And bear in mind, we say that Spina Bifida is caused by lack of enough, not really, totally no folic acid. It is a lack of enough folic acid in your blood. And so when you take this partially depleted folic acid in the food, at times you may end up having a child with Spina Bifida. For example, for our mother here, Cecilia, she can tell us and attest that she was taking those foods when she was conceiving her son John. But now that food was not really enough. And so that is why we love saying supplements are very good, because it is the only sure way that you will know that you have that enough folic acid in your body.
There are people who cannot swallow that tablet. What is your advice to them?
The advice to those parents who feel that they are not able to swallow the tablets, because not only folic acid, but there are others who cannot take even other drugs. When you weigh getting a child with disability and trying to swallow this tablet, it is better you swallow the tablet.
No.
And we advise them to try, when you're taking your food, you can swallow your tablet and then follow it with your food, such that there's a nausea that comes. Unasikia kutapika. Nausea ni kusikia kutapika wakati umekula hiyo tebe. Lakini ukifuatilisha na a food in between the food, some of the mothers have reported to us that they have been of great help to them. And even for us who are in the healthcare system, we also do swallow those tablets, because if we are planning to get pregnant, we have to use them, because again we are exposed to these children with this disability, and it also triggers our mind, and we fear also getting such a child.
So daktari, the only option for sure supplementation of folic acid in the body is swallowing that tablet.
Exactly.
Yes. So as we conclude, I would like you to tell us how you manage Spina Bifida, and especially with that gadget which you can carry. We are very eager to see. Yes.
Well, when we come to the management of the Spina Bifida, it comes with disabilities and different disabilities, and we manage them according to the disability. Spina Bifida, we have different types of Spina Bifida, and that is why one child will use a different device and the other one will use a different device. And according to the spinal column and where the mass is, that will be the sign, or whatever will determine the type of disability or the severity of your disability will be. We have, on that note, we have around 4 types of Spina Bifidas. We have a Spina Bifida that we call Meningocele. Meningocele, it is a mass. Within the mass that is in the spine, whatever protrudes there will not have, nerve in it. It is just a fluid that will protrude in that mass. We have this other one called Myelomeningocele. A Myelomeningocele, you will find that whatever protrudes in that defect, you find their nerves, you find there are blood vessels, there are muscles there, and it is the severe form of Spina Bifida, and the disability that comes with a Myelomeningocele is so severe. The other type is an occulta. An occulta means something that you're not able to see, and it presents with a dimple along the spine, which has some hairy region within that dimple. And so when we come to the management of the Spina Bifida, the surgeon will excise the mass. When he excises the mass, the disability will still remain. So if the nerves were affected, the nerves that supplies the body, even if he excises the mass, the nerves will still remain damaged. And so for this child who has the nerves that were destroyed within the mass are the nerves that supplies the lower region of the body, it means that that child will not be able to walk with the 2 feet. And that child may be wheelchair bound because he cannot walk. The other severity is where we have a child who has the lower extremity, the legs, he can be able to move. But then he is not able to use a wheelchair, he will use crutches. And so we'll manage them differently. All these children will have an effect on their bladder and their bowel. And so when we come to the bladder, these children will be leaking their urine. They are not able to control their urine. And so this is where we will need to use a certain tube that I'm going to show you. And this tube, we are going to insert it in the urethra or in the bladder so that we can drain the urine that is inside the bladder. And this will help the child not to have some infections in the bladder. So the tube looks like this. It is just a small tube. And you take this tube and insert it in the urinary bladder. When you insert it, it will drain all the urine. And when it drains the whole urine, you remove it and you clean it. In that way, the child will not leak urine wherever they go, and they are able to fit in the school or within the company of their friends. And at the same time, you'll be preventing the child from getting infections of the bladder. The other management that we do give to these children is about the bowel, because again, they are not able to defecate well or to pass their stool well. And so we use a device like this. Cecilia will hold it for me. And with this device, you put water within this bag. And we put 20 mils per kg. So you have to take the weight of the child and you put 20 mils per kg. And this water will flow with the force of gravity, and then you insert this cone in the rectum. When you place it in the rectum, the force of gravity will force the water to come into the rectum and force it as high as possible. And it will lubricate the stool, and then after sometimes you remove it and the child will pass all the stool. So with this, you will be preventing the child from getting constipation.
Mm-hmm.
Yeah.
So this one is really telling us that Spina Bifida also affects other body system, like the digestive system where the stool passes. Thank you so much, our health worker. It has been a pleasure having you with all the knowledge that you have given us. To our parent, kindly give us your parting shot.
Okay, thank you very much. To all the parents out there with kids with hydrocephalus and spina bifida, it is just a defect. Don't hide your child, expose your child, and more so to school, please. Accept our children at your schools. Mm-hmm. The disease is not contagious. It is just a condition.
Yes.
They can school normal, like our sister here, Asifa. She went to a normal school. She schooled well. So spina bifida, it's not something that make you not accept my son in your school or another child in school, please.
And also it is also a condition that should not make also parents
to
not to give birth to other children.
Yeah, like maybe before I didn't take the folic acid, and then I have seen other parents with a child with spina bifidas. They have other children which are in good condition. Yes. I'm like, okay, let me start swallowing the pills again. Now I'm good to go.
Yes.
Thank you.
Yes. How do you encourage people who are living with the same now? Talk to them as you give your parting shot.
To people living with hydrocephalus and spina bifida, first of all, they should be strong.
Yes.
And because it's not the end of life, it's in fact the beginning of life. Because there is more to life than hydrocephalus and spina bifida. And also to families with children with hydrocephalus, I think families should be the most supportive. Because if families are supportive to their kids, I think even when they go out there to the community, nothing will put them down. So having a supportive family, having supportive friends, I think having the whole supportive system, it will make you stand bold and nothing will ever put you down. So anyone living with disability, not only hydrocephalus, I think you should stand strong and be a role model to the kids that are coming up.
Thank you so much, our guests. It was a pleasure having you in this show. And to our viewer, we are here to tell you that hydrocephalus and spina bifida are conditions that can appear at any age, even though they usually appear much during birth inside the mother's womb, and they can be managed once they have been diagnosed. There is no fear, because once it is there, it is there. I urge you to have your children monitored and checked in the health facility. For those mothers who deliver at home, kindly have your babies assessed in a health facility within 3 days, within 5 days, so that they can be detected early. It was Health Talk Show whereby we were promoting child health, and you can be able to talk to us on our SMS line, which is 21144. You can also find us in Facebook page GBS TV Africa and YouTube channel GBS TV Africa. Until next time, bye-bye.